Welcome, everyone. Congratulations on securing your interview with Queen's University, the only university I think that has a campus in the UK. Interesting fact. Today we're focused on the MMI and the interview day. So we have presentations on different parts, the Casper, the application, and so on and so forth. If you would like access to those, just please send us an email and we'll happily share a link to the recording with you. And a little bit about me. My name is Kevin. I'm a first-year medical student at the Mayo Clinic in the United States. Mayo Clinic's the #1 hospital in the world. It's a top 10 medical school in the States, but I applied both Canada and US. In fact, the first time I applied, I only applied to Canada. I only applied to Canadian schools, and I got interviewed at Ottawa and McMaster. I got waitlisted and then rejected. But the second time, I applied to the US as well, and I got far more many interviews. Queen's is one of them. And I passed this first round that y'all are doing because there's 2 rounds. And I've done interviews in different provinces. So McGill and the US, I got Dartmouth and Mayo Clinic, which is where I'm at right now. So I've done every kind of MMI you can imagine because they're different across provinces, states, and every kind of interview you can imagine. And today is really the idea of the secret of the MMI. What is the difference between great answers and extraordinary answers? And I'll tell you what that means. But this is what it comes down to. Okay, so you're doing an asynchronous interview for this first stage with Queens. And it's literally like Casper. Well, not literally, but you're asked something and then the video's on and you talk blah, blah, blah. And then it's sent off into the cyberspace. And a few weeks later, some people decide the fate of your life, whether you're going to go to the next round or not. And the idea is just like this. There's an answer period and a follow-up period. There's 6 stations. Okay, and for these MMIs, you really want to be focused on the trending topics in healthcare in Ontario and in Canada. So the opioid epidemic, right? We have an opioid epidemic in every major metropolitan center in Canada. And including rural areas, we have an opioid epidemic, a homelessness crisis. Maybe not as much maybe seen in Kingston, Ontario, but to some extent, yes. And we see it across Canada. Indigenous health, this is huge. Medical system dying. There are a lot of really important healthcare topics that you must have a deep understanding of, not only a textbook understanding where you're like, okay, here are the statistics on mental health in Ontario. Oh, this many % of patients are doing this. No, you need to be an expert at giving your opinion on a topic. So not only studying these, but practicing over and over again, giving an opinion, an expert opinion on these topics. And something I would do to give great opinions, I'd go on YouTube and I'd find some like commentator, either like those internet commentators or a political commentator, right? I know you know those shows like, what is it? That funny guy, the funny British guy. Stephen Colbert. I don't know if I watched him, but I find like these political guys that would just give these opinions, and I'd learn the way they speak. Not for the politics, obviously, that's bad for your mental health, just to listen to politics all day. But listen to the way they speak, and I try to copy it, because they would speak very convincingly, because politics is BS. You know, at least half of it is anyway. So if they make a living off of it, they must be pretty good speakers. But here's the thing. The first time that I applied, I got waitlisted and then rejected from all the schools I applied to. The second time, I got into the best schools across US and Canada. So what was the difference? The difference was the first time I applied, I would have these great opinions and a great way of delivering my opinions on these topics. I would. And then I'd get an interview and they'd ask me, oh, what do you think about cancel culture? And I'm like, dude, I just spent like 2 months studying freaking like organ donation, right? I just spent 2 months studying organ donation, and now they're asking me about cancel culture, about the wealth gap. And it's really, really, as a medical student, as a future healthcare professional, you can be expected to have well-informed opinions on a wide range of topics that affects people. Because if something affects people at large, like climate change, well, then it affects their health in a certain way. And then that ties back to medicine. So you could be asked literally anything and everything. Okay, so you have to be ready for anything and everything. And these are some two really good lists of things that I would practice knowing and practice making great opinions on. And don't bother like screenshotting or whatever. We're gonna send you these slides right after the presentation. Okay. Now, let's start learning. And I think the best way to learn is always with practice. So we're gonna start with this question. Okay, let's read this question together. Imagine you're a physician and you encounter a patient with chronic pain who requests opioid medication. How would you balance the need for effective pain management with the risk of opioid addiction? Now, a great answer. Well, let's just say an answer. Let's see what an answer looks like. Okay, I would conduct a comprehensive assessment of the patient's pain. Okay, we're gonna start with saying that. So you're gonna look at the patient. What's their pain like? Does it get worse at night, or is it radiate? What kind of pain is it? Is it like muscle or whatever? Right? You're gonna talk a little bit about that, understanding the nature of their pain, how long they've had it, and I'd have open conversations with the patient about their pain experience and treatment history. If opioids are necessary, I would proceed with caution, starting at the lowest dose to avoid dependence. I would revise the treatment plan with the patient periodically, which means regularly review it and adjust as needed. And then you'd give a conclusion. So what do y'all think about this answer? Is this a good answer? So this is a pretty good answer, honestly. This is the sort of answer that I would have given the first time I interviewed in Canada. But let's see how we can make it better. Okay, because this is a solid answer. It answers everything that question is asking. It gives a very mature and well-informed opinion. Let's see what else we could do. I could first explore a multidisciplinary approach to treating pain. For example, physiotherapy, lifestyle modifications, exercise, diet. I would educate the patient about the risks of opioid use and how we can minimize these risks to build a trusting doctor-patient relationship. Cool. What if we go farther? What if we make connections to the opioid crisis, right? The opioid crisis is plaguing every major metropolitan center, across Canada, and a lot of the northern territories. Maybe we could talk about sickle cell disease and racism with respect to opioids. This is a really cool connection. Did you know that when young Black individuals, especially Black men, come to the emergency room and they're in pain and they want, to get rid of their pain, the ER doc might be like, this guy just wants opioids, right? But in reality, Black patients are more susceptible to sickle cell disease due to a generic variant, and they're underdiagnosed, or maybe people just don't think that they have sickle cell disease or never think of it when they see this patient come in who's in immense pain. So that's a very cool connection you could make. You could discuss specific medical cases relevant to Canada or Ontario. You could briefly talk about the science of opioid addiction. You can mention your knowledge, right? Science of opioid addiction, like I've taken courses in cell biology. Maybe you can talk about, reuptake, or how these, like cocaine, how these work. Of course, very briefly. You wouldn't want to spend any more than like 10% of your time on that. But just understanding, getting a bit more. You can mention your knowledge of naloxone training. Maybe you've done street medicine programs where you've been out and about on the streets, helping the homeless and administering naloxone, or teaching. So these are all cool ways to stand out. And by the way, all the questions we're using today are coming from our website, brightstudent.org, or thebrightdoctor.com. And that question comes from our opioid crisis question bank. In fact, the whole answer you saw comes straight from the website, along with ideas to go beyond, like using a prescription drug monitoring program. Because, for example, Ontario has one, a stewardship program, where they track which physicians are prescribing opioids and in what quantities, right? To see discrepancies. You don't want to be prescribing opioids where you don't have to. And then red flags, obviously, to avoid in your answers. So why do you have to give extraordinary answers? That is the question. Because, if you think of it, there's hundreds of people being interviewed, hundreds of brilliant people who got great MCAT scores. You're at Queen's, so they're looking at your extracurriculars, right? So I'm guessing you have no free time, right? You're spending it all doing your extracurriculars, great GPA, great CASPER, and so on. So how are you going to stand out? If everyone is this brilliant person, part of like the 10% that get an interview or whatever, everyone's going to be giving great answers. So if everyone's giving great answers, then you have to go that extra mile. You have to understand topics from a broader view to stand out, to get that admission where people don't. This stage of your interview right now at Queen's, only I think it's around half the people make it to the next stage, where it's a synchronous interview. And here's the way I think of it. Okay, this was me last year when I applied and I didn't get anywhere. Okay, and the way I think of it, like, these people are just pushing this block, and this is me the second year working on, chucking this thing down. And obviously when these people are here, they're looking at you like, oh, this guy's behind. So what does this mean? You have to go against the grain. The first year, this is me. This is most people. They're listening to what? White Coat Black Art, the podcast, CMAJ, the podcast, CMAG, MAJ. They're reading Doing Right. They're reading books. Can you believe it? They're reading books. I never read that book. Actually, I have no clue if that's a good book or not. Right? I've never read it. So no offense to any of those books, and I'm not saying any of them are bad resources. They could be amazing resources. CMAG and White Coat Black Art, those are amazing resources as well. But here's the key. If everyone's doing that, if everyone's reading that, how is your answer to the MMI question going to be any different than the other guy, than the other gal? It's not. So I'll tell you what I started doing that went against the grain, and how I started learning these things that would help me provide these different answers that help me stand out in my interviews and get in. So the 5 ways to stand out, I really distilled it down to these 5, are either you're going to address more perspectives than others. You're going to offer more creative alternative solutions, which can also include just how do you avoid something in the future. You can be a better speaker than others, more personable, give a more organized answer, less ums and ahs, and you look at the camera and you speak with utter confidence. You can make connections. A lot of people don't make connections. They just answer the question based off some article they read on health, healthy debate. They read some article on healthy debate, repeat it in their answer, and think they're like, oh yeah, I'm getting in. You can make connections to your personal life, your future career, or demonstrate domain-specific knowledge, like talking about naloxone training or the opioids epidemic. That would be like specific knowledge. And you can explain why. A lot of people have like cool ideas. Oh, I would make an app to track whatever. But like, why? Why would an app be a better idea than a website? Just for example, a lot of people just say cool stuff. And this brings me to this dude, the smart aleck. Everyone knows a smart aleck, at least one. And these are the people in your class that are just, they talk condescendingly to people. They just try to sound smart. But if you like really analyze what they're saying, it's like wrong half the time. Believe it or not, and I've seen this, these people make it far in these interviews, okay? Not always, but a decent amount. And that's because they can look in the camera and speak with confidence. So if I told you right now, the average length of a giraffe's neck is 12 feet. I think a lot of you all will believe me because I just said that with confidence. I just said it without any ums and ahs. And I looked at the camera and I used specific intonations, maybe that I've learned from others, very persuasive speakers. But I just completely made that up. I don't know how long a giraffe's neck is, but that's the idea. You have to look at the camera and speak with confidence and speak in an engaging manner, not a robotic manner. So I really recommend recording yourself, watching yourself speak, and seeing, can you even listen to yourself? Because if the answer is no, then I don't know how another person's going to listen to you. But these are all things that can be fixed. Should he speak for the full time? Typically, no. But but this is an asynchronous interview, so the answer is yes. And like, what else are you going to do? There's no person asking me follow-up questions. Yeah, this is a no-brainer. You're going to try to speak for the full time. Don't get cut off. Sometimes I would. Here's a big one. If it's between getting another point across and giving a conclusion, I would often pick getting another point across. But as long as I could finish that point and then say like thank you at the end, which is just something I just did all the time. So I would always try to get another point across. But if you have no other points, give a nice conclusion and then say thank you and smile. Should you go in depth or broad? Should you discuss like 20 things, or should you just talk really deeply on one thing? So what I usually do is I talk deeply on 1 or 2 things, but I always acknowledge other ideas either before or after, like, on this health policy, I think this and this, although I do agree that others may think X, Y, Z. So I briefly mention other perspectives if it's not like a pros and cons question, sometimes there are other perspectives to just quickly mention. So practice. Let's practice this question. How does the Ontario health system address the needs of Indigenous populations, and what improvements can be made? All right, this is coming from our Ontario question bank, so I'll let y'all read that. All right, let's look. The Ontario health system, so we're going to ignore the main idea here, but let's look at this answer. The Ontario health system has made efforts to address the unique healthcare needs of Indigenous populations, though there are still significant areas for improvement. This is a beautiful introductory sentence. Why? Because it fully tells your interviewer to expect that you're first going to talk about what Ontario is doing. They've made efforts to help, and then you're going to talk about the areas of improvement. So automatically, in a very subtle way, actually, you've organized your answer, and I'll talk about better ways to organize your answer as well. Or not better ways, just the way I use in other ways. But this is a very subtle and beautiful way, a very natural way to organize your answer. One way the system addresses these needs is through culturally sensitive care. This involves providing healthcare services that respect and incorporate Indigenous cultural practices, beliefs, and values. For example, some healthcare facilities in Ontario have integrated traditional healing practices alongside conventional medical treatments, recognizing the importance of holistic care that encompasses physical, mental, emotional, and spiritual well-being. This is a mature answer, and it not only shows, not only starts addressing the question, but this shows that our applicant understands what's going on in Ontario, that we have these integrated healing practices. This shows that this person has either been volunteering in hospitals or has been part of clubs or community initiatives where they've seen these things. They've seen them firsthand. How else would they say something, of this nature? They've done their research and they understand what's going on. This is not some blind applicant whose parents are like, you should apply to medical school, and they spend their time playing video games. The Ontario government has also made efforts to improve access to healthcare for Indigenous communities. This includes funding for programs and services specifically designed for Indigenous populations, such as the Aboriginal Health Access Centers, which offer a range of health and wellness services. Beautiful. We're giving them another example that addresses the question of specific like Aboriginal Health Access Centers. This shows that you understand the landscape of these issues that are being asked, and you're not giving general, like, these ethical, oh yeah, I read in this ethical book, you should do this. However, there are still notable gaps and challenges. So beautiful transition, and it aligns with this intro sentence that we're going to start talking about improvement. There are gaps and challenges. One major issue is accessibility of services, especially for those in remote or rural Indigenous communities. These areas often lack adequate healthcare facilities and professionals, leading to significant disparities in health outcomes. Beautiful. We identified, all right, this is what we're doing. Here's a point. Here's a point where we're lacking, okay? Here's a weakness. Another area for improvement is the training and education of healthcare professionals in Indigenous health. While some progress has been made, there's a need for more comprehensive and mandatory training on cultural competence and historical and social factors that impact the health of Indigenous people. So this is beautiful. Another area of improvement. And now we're going to go even more beyond. We're going to give ideas on how we're going to fix things, right? You could have even included that in your introduction. Furthermore, there's a need for greater involvement of Indigenous communities in the planning and delivery of healthcare services. This could be achieved, now we're giving ideas to solve things, through more meaningful partnerships and collaboration with Indigenous leaders and organizations, ensuring that healthcare initiatives are community-driven and responsive to their specific needs. Beautiful. Here's what Ontario is doing. Here are areas for improvement. Here is a solution. Here's how we can start making things better. Get those Indigenous leaders, those community leaders, in the decision-making rooms so they can help shape policy. They can help shape legislature to improve their needs. Like, who's going to understand their needs better than them? It's not going to be some random person just making laws up that they think are going to help. Let's get them involved in a shared decision-making process, which, by the way, is a CanMed role. So by saying your answer, I don't know if you've noticed this. This answer is blasting CanMed roles, actually, but it's not because they're like, they have like a notepad of like CanMed roles, like, oh, okay, let me mention this one. This is just a person who's understood these health topics and has formulated their opinions on them in an expert way. And then there's a conclusion, which we're going to skip. So yeah, again, we're demonstrating relevant knowledge of Ontario policies. We're providing multifaceted ways of addressing the topic and understanding of the issues. And we have innovative ideas at the end. Okay. And there's also other cool ideas we could have said, like having, increased investment in healthcare infrastructure in remote Indigenous communities. So for example, like telehealth, right? You have remote Indigenous communities, telehealth, tele-ICUs, and so on. And there's always like red flags that we provide to avoid, like don't overlook the historical context of Indigenous health disparities, including the impact of colonization and residential schools. So this is something you could have talked about, right? Colonization, residential schools, forced sterilizations. These are things that have affected the Indigenous population and might impact their trust in medical care. So always great ideas to go beyond and ways you can go beyond other applicants who are just providing, stock, ethical, theoretical answers, beneficence, non-maleficence, you know the ones. Cool, how's everybody doing? We're gonna get into the last section of the presentation on addressing personal questions. So for first impression, this is a huge one for me. In the thinking time, near the end, the last 10 seconds, 15 seconds, I would practice the first sentence I'd say. So I'd say with utmost confidence, and I'd say without any like hesitation or goof ups. Okay, so that last sentence, when I say it, it's actually the second time I'm saying it. When the camera's on, it's the second time I'm saying it. And always, you don't introduce yourself because it's an asynchronous interview, but you do smile. Okay, I recommend smiling. I always say thank you at the end, even on the asynchronous ones. Now, there could be personal questions or things that could relate to something. Hey, I've worked with Indigenous populations. Oh, I've worked with, something that relates to the opioid crisis. You can always have these stories, even if it's not an actual personal question, and it can help set you apart. So you could be asked, there's no follow-up questions, but actually there are. You could be asked personal questions that relate to any of the CanMeds roles. So I'm not going to bore you with the CanMeds roles, but I like the American list. You don't have to use this, but communication, I would have stories on each of these pillars, like problem solving, empathy, blah, blah, blah. I would have just these stories that relate to each of these topics. And the way that you answer these personal questions is something called the STAR method, okay? STAR. And it means situation, task, action, result. So let's see, what's the biggest challenge you've overcome? Last semester in the McMaster Bio Society, while organizing a programming skills workshop for first-year students, we encountered an unexpected vendor cancellation, leaving us without crucial materials. I was tasked with swiftly finding a replacement vendor without overshooting our budget. S&T, out of there. Why? Because S&T don't get you any points. They really don't. So this is like obviously not the biggest challenge, right? It's just like a mini challenge. But I don't care if your biggest challenge was like curing cancer and you were in the prime minister's office and then, you got a Nobel Prize. What matters is the A and the R. So just describing the situation, get that out of there as quick as you can. Focus on delivering that very succinctly. Don't be verbose and just say that as quick as possible so you can start collecting your points in these two last sections. Consequently, I quickly researched alternative suppliers, assessed their offerings against our needs, and strategically approached the most promising ones to renegotiate terms suitable for our budget. I used strategies like calling suppliers instead of email to ensure rapid communication. Ultimately, we secured the necessary materials under budget, and the workshop went on without a hitch, earning praise from attendees. Beautiful. This is a very mature answer to this question. And I mean, it's very succinct, and then it hits everything you need to, because this is A and R where you get your points. And that's where you show those CanMed roles, for example. But there's a missing letter here. And I think I've invented this, the START method. But if I haven't, you can let me know. You can maybe email me that you did not invent this, Kevin. But there's a missing T, and the T stands for takeaway. And where possible, either connect these stories to a personal story or relate it to your future profession, and it'll make sense which one you use. So in this question, what I would say is, as I pursue a career in medicine, I will continue to draw on such skills to stay collected in rapidly changing situations. Through strong communication skills along with my problem solving, I will continue to ensure team needs are met for the benefit of my future patients. So here, this colored part is maybe the sort of answer I'd give the first year I applied and I interviewed. This stuff is what I really started refining the second time. Not only do I give you a beautiful answer, but I give you a connection to my future career that shows maturity. It shows that I reflected on medicine, that I know what it's like, what it expects of me, and how these skills that I built are going to help me as a future physician or a future student. As a medical student, I'm going to need these skills, blah, blah, blah. Beautiful, beautiful connections you can make. So have stories ready for all of these. And you're going to try to connect them to your values, of course, your future career if you can, the CanMeds items. I had a friend who's at Queen's Medicine now, and he would just get a list of all these stories on cue cards, like one cue card per personal story from his life. And then he'd have another stack of these CanMed rolls, or the pillars I have on the left. He'd grab a beer on a Friday night and just mix and match at random and try to make the story connect with the CanMed roll. This is amazing because sometimes you could be asked like a weird question that's going to make you think on your toes. And if you've been practicing this, you're going to be really quick to, okay, yeah, I could use this story. You're going to have like 5 stories you could use. You're not going to be like restricted to 1 or 2 stories or like just thinking, because that's the worst part when you don't know what you're going to say, because now you have to spend 2 minutes thinking of the story instead of planning how you're going to say it. And lastly, this is a top tip. This is like, woo. I stole this straight out of the American playbook, because in the US here, there's like over 150 medical schools. And top applicants will apply to like 30 medical schools, get interviewed at like 20, get into like 10. Okay, the top applicants. I know. We envy them. And the medical schools want to know, why do you want to come to this medical school? In Canada, it's not like that. It's like you're lucky to even get a single interview. You're lucky to even get into a single medical school. It's the way it is. So I have been asked before, I'm not going to say the school just because of these NDAs or whatever, but I have been asked, like, why do you want to come to this school? But that's the only one time I've been asked across 2 cycles. Though, imagine this. You're asked some question about the opioid crisis or antibiotic resistance, for example. And then you say, oh, you give your answer, your very well-informed answer. And then you say, at Queen's, I know there's antibiotic resistance research being done, and there's these departments, and I'm very interested in contributing to that research as a medical student. Wow. This is standard for American interviewees. Like, they always try to talk about the medical school, but I've never seen this in Canadians. Talk, if you can, go research Queens, go on their website, go click every tab, right? Like, you're on your phone in the subway, just blah, 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 click every tab, see what's going on. You will find cool things, global health programs, research programs, summer internships, maybe clinical sites that they rotate to that are very interesting. Find these things, you might just be able to include them in your answer, and that will make a huge difference. So, some final pro tips. Organization. This is about letting your amazing answers get the recognition they deserve. And I promise I'd show you a different way to do it too. This is the way I did it. In my first sentence or two, I just give an outline of what I was going to talk about. So I'd say like, hello, I will begin by addressing the pros and cons of implementing such a public health policy before giving my opinion and then relating it to an experience I have had in the area. Beautiful. This is such a good intro because most people are just like they just start talking. You don't even know where they're going to go with their answer. And then it's kind of dangerous because you could like end up on a tangent and like midway through your talking, you're like, oh shoot, that's another idea. Then you jump there and then it just becomes incoherent, okay? If you give this, the person who's watching your video is going to be like, oh wow, I know exactly what to expect. It makes it it's much easier to listen to you. And then you're like, oh, I'm going to relate it to an experience I've had in the area. Wow. So the last 20 people who answered this question that this person had to listen to have given like the same whatever stock answer to this question. But now you're like, well, I'm going to give you a great answer. But I'm also at the end going to give you a little gift. I'm going to give you a personal experience I've had in the area. You've already started standing out before you even started your answer. You haven't even given your answer and you're already standing out. Because now they're like on the edge of their seat. They're like, oh, I've listened to the boring answer 20 times, but now this person's going to tell me a cool story at the end. And you tell them from the get-go. It's kind of like one of those cliffhanger YouTube videos. Now, remember, first impressions are critical, and you can consider a conclusion at the end, but it's not always necessary. Yeah. I don't think I always had one. Avoid extreme stances. So this sounds normal, like it sounds like everyone should understand this, but it's kind of nuanced because imagine you're asked, like, should pharmaceutical companies be allowed to provide gifts, such as free samples of their latest medicinal compounds to physicians? You know, first time I applied, I might be like, no, 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 no. Pharmaceutical companies are the worst and they're bad people and they just want to make money. But if you think of it, like, all right, give it like a little second to think. Maybe because in Ontario, we don't have free medications. We don't have free drugs. We have free healthcare at the point of service, right? On most things, most things are free, but not when it comes to medications. You're either using your parents' insurance to kind of reduce the cost of like an antibiotic or whatnot, or you're using you're using someone's insurance, or maybe you're employed and you're using your own insurance there. So what if these pharmaceutical companies gave these gifts as these drug gifts, and now there's patients that this doctor has who can't afford these medications, right? There's a patient who can't afford medications. Maybe these free samples can go to them and they can help save their lives or help manage their chronic condition and so on, right? So there's always another side if you spend like 1 minute, and it shows your maturity when everyone is like, no, pharmaceutical companies, no, that's a conflict of interest. It's a conflict of interest. The physician should not be taking gifts from pharmaceutical companies. But now you're like, well, maybe the gift can help in this way. So always have nuance in your answer. Study at night. When I was a teenager, I read this book, 7 Habits of Highly Effective Teens, and it said the stuff you do before you go to bed, the 45 minutes to an hour before you go to bed, is replayed in your head up to 6 times more than anything else you did that day. Now, I don't know how correct the number is, but I believe it. Because if you watch like news and it's like murder and shootings, and if you watch that before you go to bed, you're going to have bad sleep. If you watch a horror movie before you go to bed, you're going to have nightmares, right? If you go on Instagram before you go to bed, your brain's going to be filled with garbage. It's going to be filled with crap. So I would always practice right before, like at night, especially right before I went to bed. So this like perspective taking mentality of the MMI would kind of become stamped into my brain, because I would just go to bed right after, and then it would get replayed in my head, and then the next day, and I'd always study at night. Also, how did I stand out? How do I go against the grain? Everybody's reading, doing right. Everybody's reading, listening to the same podcasts. I would listen to like Nature Biotechnology, MIT Tech Review. They're like, that's actually a website and a publication. I'd go to the gym and listen to stuff on economics, on the economics of the Ukraine war, for example, on finance, on technology. Get a mix of viewpoints, okay? And this helped me just give answers that nobody else could give, because I spent the time no one did to go beyond. Lastly, zoom out, because sometimes you won't be able to see the full like block of text or whatever on the interview software you're going to use. So just maybe go on 90% zoom on your browser. Share videos of your answers with colleagues. So remember, I always practiced filming myself, recording myself under time, right? If I had like 2 minutes to answer, I'd give it like 1:30. And this is what our website allows you to do. So we have question banks on medicine, the Casper, and a bunch of mini question banks on things like Ontario health policy. So if I come here, right, let's just see all the 100 questions. Let's go back. I'm going to go to test mode. I'm going to create a practice session with 10 tests. I'm going to give myself 2 minutes to read the question, just like what you would do, and then give myself a very short period of time, only 2 minutes to answer, because I really want to practice being succinct and having effective delivery. And when I ask you a question, describe a time you showed empathy, you'd be on the timer, right? There are a lot of different types of questions. What are different types of contraception available to female, pros and cons, right? Ethics, and so on. So let's just see one of them. Which do you think medical schools should value more when evaluating applicants? Standardized test scores or GPA or activities and accomplishments? And then you can give your answer, right? So it'll film you. And once the timer's up, and I'm just going to skip ahead, and then you can review your answer. You can save it. I would always save these videos and keep going back and rewatching my answers, seeing if I was engaging, see if I could say something better, right? And then you always have these answers, red flags, and the go beyond ideas, as we've shown. And lastly, practice. There's a lot of tips. I mean, there's a lot of topics to understand, not only at like a textbook level, but being able to provide your expert opinion on them, and then maybe connect a personal experience to them, or one of those takeaways. Obviously, we're going to give you this list, so you don't have to screenshot it. But I do want to bring it back. We have Ontario Health Policy, mini banks. So we do a lot of the research for you. Opioid crisis, telehealth, alternative medicine. We have US health policy. So this is huge. A lot of the times in my answers, especially on health policy questions, right, I would mention, okay, not only do I give an opinion, but I would talk about what America's doing, what Singapore is doing, what the Bismarck system in Germany or the NHS in England. I researched all of these systems, and I gave these in-depth answers that are like, I'm not just giving you some stuff I read on CBC. I've actually looked at how other countries are doing, and that made all the difference. That was huge for me. So you can look at other provinces: British Columbia health policy, AI in healthcare, Manitoba, genetic testing, CRISPR, vaccine ethics, and so on. So we have a lot of research done for you and shown in the answer format, along with all the ideas to go beyond and red flags to avoid. And we'll be giving you a subscription credit to our monthly subscription right after this webinar with the email containing the slides. That is it, y'all. Are there any questions?